Hi, welcome to AIM Physio. I'm Mark Humphries.
I'm Isabel Foden.
And today we're just going to talk to you about a couple of very simple exercises to help with common lower back pain.
So these exercises are designed to be done every day and they're to improve strength and flexibility.
Okay, so the first exercise that we're going to look at is an exercise lay down, and at home we'd recommend that you do this on a bed rather than on the floor. So Isabel's going to demonstrate. We're going to lie down on the bed, and the exercise we're going to do first of all is called a bridge. Okay, so for the first part of the exercise is the position. Now we need to be on the back with the knees bent and the feet roughly shoulder width apart. So the position Isabel's in at the moment is absolutely fine. What we're going to do is we're going to put the hands down on the side of the bed just for balance. The technique that we're going to use is to clench and squeeze the buttock muscles, and we're going to very slowly lift the pelvis off the bed towards the ceiling. And then very slowly down. So, perfectly demonstrated. The key that we're looking for on this technique is control. So, by control, we mean that the hips shouldn't wobble on the way up or the way down, as demonstrated there. And the movement should be nice and fluid and smooth, rather than jerky in nature. And the other common mistake that we see is that one hip shouldn't lead in front of the other. Okay, so we'll go back to the initial bridge. So it's squeeze and slowly lift, pause, and then slowly down. Typically we'd recommend anywhere between 8 and 10 repetitions of this. It's a brilliant exercise to strengthen the lower back, the buttock muscles, and generally help to get things moving. So the second exercise we're going to talk about today is an exercise for the lower middle back and upper lower back using a foam roller. Foam rollers can be bought nowadays very cheaply from sports shops, most supermarkets, obviously on the internet as well. So what we're going to do is we're going to show you an exercise where Isabel's going to lie down on the foam roller. For this at home, we would normally recommend you do this on the floor rather than on the bed. For the purposes of this video, we're going to use our treatment bed. So first thing we're going to do is ask Isabel to lie down on her back, and we're going to position the foam roller just under the shoulders. Okay, now the key with this particular exercise, when Isabel starts to extend over the foam roller, is she's going to push back using the legs, and we're going to keep the back fairly flat during the whole exercise. So if we just ask her to move initially, okay, and we can then roll back in. So we're going to pull back in using the heels. Now, a really common mistake with the foam roller that we see for this particular area is to actually hinge with the hips and push the hips up towards the ceiling. What that's going to do is it's just going to increase the load on the spine and actually cause a bit of discomfort rather than relieve pain. Hopefully you found those exercises useful in helping to manage your pain.
If you would like any further information or to book an appointment, the link for our website is at the end of the video.